Hello everyone, let's study chapter 9. So, our human has a very long history to control the microorganism. And so we have so now we have different methods to control the microorganisms such as sterilization, disinfection, and decontamination, antisepsis. So this table shows the difference of this method. Sterilization, so it can destroy or remove all the uh, viable microorganisms, including the viruses. So the example would be the heat or the clay or burning. Okay, disinfection. So that's a physical process or chemical reagent to destroy the vegetative pathogens, but not the endospore. Decontamination, sanitization is a cleansing technique that can remove the microorganism and there's debris or the toxins. Antisepsis, degermination actually to reduce the number. Okay, reduce number, such as alcohol, the surgical hand scribe. Okay, so we can see here. So this diagram shows that we can use either physical agent or chemical agent um, to perform all these methods. So actually the bacteria, the microorganism, so has the capacity to be resistant to all these methods. So when we do this method to kill the microorganism, actually, so we face to actually a mixture of the microorganisms. So we don't face to a certain colony of microorganisms. So, for example, if we want to clean the skin, actually on the surface of skin, so there are all kinds of microorganisms. Okay. Also, the endospore is very difficult to be killed. So so the best method is the sterilization, because sterilization can eliminate the endospore. So if we can eliminate the endospore, that means this area is completely clean. Okay. Um, so here we can see different microorganisms has different capacity to be resistant to the cleaning methods. Okay, so the endospore and the prions are the most strong stuff that so that can be resistant to all these cleaning methods. So here are some methods that we commonly use in clinic or our house. Okay, such as heat. Okay, heat. Um, so if we want to use heat to eliminate the aerosols, so we have to heat the stuff to the 120 degrees Celsius. Okay, radiation. So we have to use 4,000 degrees. So uh, so when we do the cleaning processes, so the agent that we use can either be the bactericide. Bactericide means this process can completely eliminate the bacteria, but not the endospore. Endospore is endospore is very difficult to be killed. Uh, so based on different so if the process can kill bacteria, so this bactericide. If the process can kill the fungi, fungicide. So if it can eliminate the virus, that's the virucide. So if it can eliminate the endospore, so that's the sporicide. Germicide or microbicide is a chemical agent that can kill the microorganism. Sepsis. Sepsis means the growth of microorganisms in the blood, okay, or other tissues. A sepsis means all the processes that can prevent the can keep the tissues sterilized and prevent infections. A septic technique means all the processes that use for the antisepsis. Antiseptic uh, is a chemical agent that so that applied so that is applied uh, to the body surface or any instruments to prevent the vegetative pathogens. For example, to clean the skin before the surgery or the injection. So when we use the iodines compounds, so this is antiseptic process. Or the soybean wound with the hydrogen peroxide, even the hand washing is also antiseptic. Bacteriostatic means use the chemical agent to prevent the growth of bacteria. So it's not a cure, okay? So the bacteria may still be alive there. However, so the bacteria stops the growth. So that is the bacteriostatic. Fungistatic means to inhibit the fungi. Antiseptic. So many antiseptic stuff that we use as microbiostatic. Okay, because microbiostatic stuff is relative less toxic to our human cells. So that's why it's widely used in our life, in our home. However, it cannot kill the bacteria. So based on different stuff, so we can choose different process for the sterilization. For example, for the critical medical devices, because those medical devices will contact the patient's tissues, so those had to be sterilized before use. Semi-critical devices just contact the mucosa membrane. So it had so those had to be also high level disinfected. Okay. Normally, so we still use the sterilization method to to clean these devices. Non-critical devices, so those devices don't touch the patient or don't touch the skin, okay? So for those devices, we may use low level disinfections, such as facial masks, okay, and the gloves. So we because those devices only touch the skin, okay, so those devices don't need the level high level sterilization methods. So since we also use a lot of chemicals, so those substances also need sterilization. For example, the solid stuff such as rubber, or the liquid such as the serum. So we need sterilization those materials that need so that are used in the clinic. So based on the different characteristics of this stuff, so we have to choose different process. We also have to think about the cost, efficiency, and the method of disposal before we choose the sterilization process. So microbial death means permanently termination of the microorganism. Since the microorganisms don't have the vital sign like our human, so how do we determine how do we determine that how do we determine if the microorganism is really dead? So actually, so we can pick the colony of this microorganism after sterilization, and then place those microorganisms on the growth plate to observe if those microorganisms can still grow or not. So if the microorganism cannot grow on the plate, that means the microorganism are died. So the factors affect the death rate would be the threshold of the agent that so the agent that need for the cleaning. So the so it takes certain times for the cleaning reagent to kill the microorganism. Also, if the microorganism are in the active state, so it's very easy to kill. However, if those microorganisms is so this microorganism hibernate, so they don't metabolism actively, so it is difficult to kill those microorganisms. So eventually, so if we meet all the conditions that are needed to kill the microorganism, so the microorganism should be die, okay? We also have to think about the number of the microbes. If there are a number of microorganisms, so we may need more reagent to kill those group of microorganisms. We also have to think about the nature of the microorganism. So if those microorganisms have already generated the endospore, okay, because if they have endospore, so we may have to choose a tough method to sterilize the microorganism. Temperature and pH is also considered for the process. Concentration of the reagent, okay. UV radiation. For example, so the UV radiation at 260 nanometers is the most effective. So we have to choose this portion of UV radiation. So if the process agent is at a high concentration, so that agent will have the most effective. So yeah, so normally we choose the highest concentration to sterilize the materials. So if so we had to think about the so one way choose those sterilization process, we have to think about the other conditions such as the patient's saliva, blood, or facts. Okay, because those can actually dilute our sterilization agent. Okay, so they may decrease the efficiency of our sterilization. Okay. So before we choose the sterilization process, we have to think about the nature of the microorganism, because certain antimicrobial reagents only target a certain group of microorganisms. So we have to know what microorganisms are, so that we have to kill, okay, and choose the correct antimicrobial agents. When we do the sterilization process, we also have to know so what target those antimicrobial reagents work on. For example, certain reagents work on the cell wall, okay. Some work on the cytoplasmic membrane, and also some reagents work on the protein synthesis and cellular processes such as DNA. So we have to know that. For example, so the alcohol detergents can work on the cell wall, okay. Detergent also work on the cytoplasmic membrane. So the radiation, ethylene oxide, and formaldehyde can target on the cellular synthesis. Yes, so we have to know that. For example, the detergent, okay, the detergent is also known as a surfactant, okay, because we use detergent to clean our clothes, to clean our face. So why detergent can clean our face? Because detergent has the characteristics of a surfactant, so it can dissolve the oil, the dirt. Okay, so the same thing. Once detergent is used for the sterilization, so it can be conjugated to the plasma membrane and destroys the plus plasma membrane cause the leaking of this membrane. Now let's work on this question. The use of iodine compound to prepare for the skin of the for the surgery is known as so I'll give you 5 seconds. So it's known as antisepsis. So the method of physical control. So let me introduce the methods. The first is the heat. Okay. So the heat we have the moisture heat and dry heat. Moisture heat so that means we heat the water and generate the steam, water steam. Okay. So so the so the moisture heat can be between 60 degree to 135 degree. Okay. So the moisture heat actually is better than the dry heat. Dry heat, so we just increase the temperature of the air. Okay. Or dry heat can reach a high temperature such as 160 or to several thousand degree. Okay, several thousand degree. So moisture heat actually. So we can choose different temperature based on the material we need to sterilize. Okay. So it can actually achieve the same effectiveness as the dry heat. So it can cause microorganism. Uh, so the so the so the materials in the microorganism to be coagulated, okay, and denatured, okay, such as the protein and all the organic stuff. The dry heat can, since the dry heat, so it can cause microorganism dehydration, okay, dehydration. So if the water is removed, so it can also cause the denaturation of the protein. So it can also, so once the temperature is very high, such as several thousand degrees, so the dry heat can directly burn the microorganism. So this is the protein. Okay, protein. So we know protein has different structures, such as tertiary, quaternary structure, right? Um, so once we use certain reagents um, for the sterilization, so this actually can change the can alternate the protein structure, cause the denaturation of the proteins. Okay, for example, the reagents can bind to certain region of the proteins and denatuate the protein. So this is table shows the moisture heat and dry heat. Okay, we can see moisture heat actually is better than the dry heat because it's just because the temperature is relatively low and the time that this heat needed is also short. So the bacteria can generate endospores. Okay, Indoor sports exhibit the greatest resistance to the dry, to the high temperature, to the low temperature. So we may need more time with moisture heat to completely eliminate the indoor sports. Vegetative cell is very easy to be eliminated because they are very sensitive to the heat. For example, some microorganisms can only endure 50 degrees for 3 minutes. Okay, so we don't need too high temperature. So we just 50, 60 degrees. We can kill all these vegetative microorganisms. So actually the pathogens the pathogens microorganism actually have the same susceptible as the non-pathogens microorganisms because they are all microorganisms. They actually share the most common structure and organic materials. So there is no sterilization difference between the pathogen or the non-pathogen. So the fungi, protozoa, and worms are similar because they are all sensitive to heat. Okay, because those living organisms have more complex structure. So the more complex structure, the more sensitive to the heat. Okay. So viruses are resistant to the heat because viruses have very simple structure. So they can tolerate the however, so viruses because most of viruses are also easier to be eliminated. Okay, many viruses cannot survive in the environment. Okay. So thermal dice time is the shortest time required to kill the microorganism. Thermal death point is the lowest temperature that is required to kill the microorganism. So here is the moist heat method such as boiling water, pasteurization. Pasteurization is widely used for the disinfection of the beverage and milk. Okay, it's still widely used now. So we also have the autoclaves. Okay, so it's widely used in the clinic and research. So the research facilities. Dry heat methods such as direct burning, direct burning with the flame, okay, and the hot air oven. They also widely used now. So the cold actually, so low temperature condition actually can inhibit the growth of microorganisms. However, microorganisms can induce the low temperature very rare. Okay, even however the low so the cold cannot kill most microorganisms. So the microorganisms can just hibernate. So they once the temperature reach to the ideal level, so they can start to grow again. So for example, we can use the extreme low temperature to keep the microorganism for long term, for long time. Okay, so such as several years. So desiccation. Desiccation means so that means vegetative cell directly exposed to normal room temperature gradually become dehydrated. Uh, so the lithization means combination of the freezing and drying. So this is method of preserving microorganisms in vital state for many years. So the radiation actually, we use a very small, it's a very tight region of radiation for the sterilization, such as the gamma rays, X-rays, and UV, ultraviolet radiation. So the gamma rays and X-rays, they are the ionizing radiation. Okay, they are also harmful to the human or animals. However, the UV radiation is non-ionizing radiation. So the UV radiation is relatively safe for the human. So we can use certain material to block the UV radiation. However, the penetration of the gamma rays and X-rays is very strong. Okay, so it's difficult to use the ordinary material to block those radiation. So that's why. So we use UV radiation a lot. Okay, not the gamma and X-ray. So how the radiation works? Because the radiation can cause the dimer of the thymine. Okay, so it can uh, directly cause the DNA and RNA damage. Okay, they can also induce the oxidative stress in the microorganism, so they can kill the bacteria. Well, we also can use a filter. Okay, filter to we can also use a very tiny hole filter for the sterilization. For example, we can filter the liquid. Okay, so all the microorganisms will be filtrated from the liquid. So we can use this method for certain liquid materials. Uh, so those cannot be sterilized in the tough conditions, such as very high temperature heat. Okay, or the radiation. Okay, for example, all the blood products. Okay, so we can use filtration. For example, the blood products, vaccine drugs, IV fluid enzymes or mediums. Okay, all this need filtration. However, filtration cannot eliminate the toxin, because toxin are certain chemicals. They are dissolved in the water, so they cannot be filtrated. So this diagram shows how the filtration works, because those are the membrane with very tiny holes. So all the microorganisms are filtrated from the liquid. Osmotic pressure. We also can use high concentration of salt or sugar to inhibit the microorganism, because the salt still generates the hypotonic environment, so it's very difficult for the bacteria to grow in those medium. Okay, so that's why we have used the salt to pickling, smoking, drying food. Um, because we have used this method to preserve food for 1,000 years, right? So the osmotic method is not actually it's not a sterilization technique. Okay, uh, because so this technique can inhibit the bacteria, however, it cannot completely kill the bacteria. Now let's work on this question. Which physical control method would be used to sterilize the foreign items? So I give you 5 seconds. So we can see so for the A, okay, for the A, so the inoculation loop, so we can use the flame to burn this, okay. So for the glass beer, we can use the most heat, okay, most heat. Vaccine, we have to use the filtration. We have to use filtration. Powders and oils. Mm, so powders, oils. We can use we can use moisture heat. Okay, we can use moisture heat. So and the chemical agents in the microbial control. Uh, so we have so most chemical agents used in the control actually are the liquids or the gases. Okay, gases. So they can work as the disinfection or the antiseptic. Okay, or either the sterilization. uh, so the aqueous means chemicals can dissolve in water or solvents. Tinctures means dissolved in pure alcohol or water alcohol mixture. Okay. So some material uh, can work very quickly. Okay, can work very quickly with low concentration, and many agents can be kept for a long time. So so those materials the long-term stability. Okay. Also, since those material are not specific, so they can be used for the sterilization for the broader spectrum to eliminate the broader spectrum of microorganisms. So so based on the effects, so we can classify those agents to the high, intermediate, low level germicides. Okay, high level germicides means it can kill the endospores. Okay, intermediate level germicides can kill fungi, but not the bacteria. Okay, low-level germicides only kill the vegetative bacteria, fungi. So when we use germicides, we have to think about the factors that affect germicides effect. Okay, such as natures of, such as what kind of microorganism we need to eliminate. Okay, so what kind of material we need to treat. Okay, and different and the degree of contamination. Okay, if the material is very dirty. Okay, so that means it may contains all kinds of microorganisms. Maybe we have to use the broad spectrum germicides for the sterilization. Also the time exposure. Okay, so longer time exposure, that means more contamination. So these are the agents, okay, such as chlorine, acid, alcohol, hydrogen peroxides. So they can treat all these microorganisms. So we can prepare different solution, different concentration of those agents. So when we prepare different concentrations, we need to dilute those agents. Okay, so the reason to dilute those agents, because when we dilute those agents, so we can decrease the we can decrease the toxicity effect of those agents to the human, right? Also, so we can also use those agents economically with the dilution. For example, for the chlorine, so chlorine can be diluted to very low concentration. However, so the chlorine still has the effect to eliminate the microorganism. So the length of exposure. So if the microorganisms are exposed to those germicide agents for a long time, so that will be ideal. Okay, because the longer exposure to the germicides, so the more likely those microorganisms will be killed. Okay. So we also have to think about the material we treat. Okay, for example, smooth solid objects such as glass. Okay, so the glass will be reliably disinfected than the material with many pores, pockets. Okay, like the soil. Okay, the soil contains much more microorganisms than the glass, right? Also, if the materials are the organic material, so the organic material may take the reaction with a germicide agent. Okay, so that can inhibit the effect of germicides. So this table shows the germ size can work on certain microorganisms. For example, chlorine can kill the endospore. Okay, so it can kill all the microorganisms. So we have those different chlorine to choose. Okay, such as the hypochlorite. Okay, chloramine. Okay. So the iodine can also kill the endospore. Okay, however, it's slowly. It can also kill all kinds of microorganisms. So we can use the iodine insulation idle 4. Okay. So this is as the side effects of all these agents. Okay. So the oxidizing agent can kill the endospore and other, such as hydrogen peroxide. Aldehyde can kill the endospore and all others. And phenol can kill some bacteria, virus, fungi, gases, gases sterilant, such as ethylene oxide, can kill endospore and others. Chlorhexidine can kill most bacteria and virus. Alcohol can kill most bacteria, virus, and fungi. Okay, so now we have all kinds of these germ-size products available in the market. Okay, such as Lysol, Clorox. So Lysol, Clorox are the detergent. So the Lysol, Middle and Telex as halogen. We also have the best ones, Scope, Pansol. So we have all kinds of these in the market. So which of following antimicrobial chemicals are considered sterilization agents? So the sterilizing agent, that means it can kill all the microorganisms, includes the endospore. Okay, endospore. So we can see the hydrogen peroxide. Okay, hydrogen peroxide can kill the endospore and all. Okay, so this is appendix. So please use this for your study.